Today I spoke with Ray DePaola and Karen Harker from the Center for Safer Communities, which used to be Turning Points Network here in Claremont. We discussed the center's mission of crisis support, prevention, and education. We talked about the empowerment model and what that means. We talked about the cycle of abuse and generational issues. We talked about some common myths and misunderstandings as it relates to domestic and sexual violence. We talked about current trends that they're seeing here in Claremont and in Sullivan County. And we talked about how everybody can help make a difference in combating domestic and sexual violence. This was a fascinating conversation, and I hope that you can take away as much from it as I did. October is Domestic Violence Awareness Month, so we thought it would be a good time to have some folks in from the Center for Safer Communities to talk about what services you offer to the city of Claremont and to the sort of larger community. Before we really get started on what you all do, I think it would be best to introduce you and have you introduce yourself. So I'm here with Karen Harker and Ray DePaula. If you just tell me a little bit about yourself, Karen, and how long you've been with the center and why it is that you got into this field of work.
Sure. So I'm Karen, and I have been at Center for Safer Communities for 2 months.
Wow, cool.
I took over for Susan, who was our former development and communications manager,
Yeah.
and so I'm now the new development and communications person, doing all things related to donors and communications.
Oh, so this is kind of like right up your alley, then,
Exactly.
right?
Yeah, exactly.
What did you do before this?
I was at another nonprofit in Vermont called Vermont Adult Learning.
Yeah.
I was the regional director of Windsor County, so I oversaw 2 learning centers there. I actually started my career as a high school English teacher in North Carolina, so a
Perfect.
bit of a career change, a different career trajectory, but I'm loving it. So
Did any of your prior jobs involve you doing a podcast with the police chief?
it did not.
No,
This is a
no.
first.
Yeah, well, welcome aboard in 2 months too.
Yeah,
So,
exactly.
so Ray, welcome, and if you don't mind, what brought you to the Center for Safer Communities and to Claremont?
Yep. So I've been working for the agency for a year and a half now. I was hired in a dual role, so I do both prevention education and direct services. What brought me was really a passion for working with people in crisis, but also looking at the dynamic of men and how men can be a part of the solution, and really wanting to bring a focus to that. And I'm really grateful that the agency finds a fit where I can serve that purpose.
Yeah, I think there's two things that you said there that are super important. Number one is, I don't think that people realize how much prevention and education the center does in the city, in the schools. So if you wouldn't mind, just to touch on that just a little bit, what you offer from that perspective, and we'll get into it much more deeply as we go through the interview. But
Sure. Yeah, so the agency, we cover Sullivan County. So we are in as many schools as will have us across Sullivan County. We go in and we talk with kids. We start with pre-K, go all the way to 12th grade. We've even gone to RVCC and do classes there. But we start with talking about, you know, behaviors, talking about keeping your hands to yourself, asking for permission, pretty basic stuff that we think most families, most kiddos are getting exposed to, and we're just reinforcing those messages. But it really sets the groundwork to then, talking to high schoolers about consent.
yeah,
It's asking permission.
Right.
It's accepting no for an answer, and learning, respecting one another, and yeah, being part of a healthy, safe community.
I'm and I say it with great pride, but I'm a Stevens alum, and I have vivid memories of when I was in high school. Back then, obviously, it was Women's Supportive Services, and then it transitioned to Turning Points Network, and here we are today with the Center for Safer Communities. But I remember a person coming in from Women's Supportive Services at the time and talking to one of the classes that I was in about the cycle of violence and how that worked out, and obviously talking about consent. And so I know that piece has been around for a long time, the education and prevention piece. But I think that sometimes gets lost on community members. Obviously, for you folks, it doesn't get lost on you, but I think for some of folks in the community, they think that there probably is this assumption that you're there for a singular purpose, which is crisis response. And you have a much broader role than that in the community, I think.
Yeah.
And the other thing that I think that you said that was really, really interesting, and I think it's it would challenge what the normal idea of what people in our community have, but this idea that how can men in the community be a part of the solution, and I think, again, if you hark back 2 names ago, it was Women's Supportive Services, right? So there's probably maybe some stigma that goes along with men receiving crisis support, but then again, there's also this, like, half of the population, like, how can they help, right? So if you wouldn't mind touch on that just a little bit.
Yeah, I mean, the name changes from Women's Supportive Services to Turning Points to now where we are with Safer Communities. It's been about expanding, the understanding of who is it that we're serving, who is it that we help. And that was a big point of the first change was, it's not just women who are in crisis. It's families, it's all genders, it's all people that can suffer from domestic violence, sexual assault. So we want to support all of that. But yeah, with that focus, it's more often women.
Yeah.
But there's also the reality that it's more often men who are the perpetrators.
Correct. Yeah.
To a great percentage.
Yeah.
I mean, it's not even close.
Yeah.
And so, and sometimes what can get lost in that message is, you're saying all men are bad, which of course we're not.
No. But if you just look at the statistics for domestic and sexual violence,
that the harm comes from men. So a great majority of the men are not causing the harm, but they're also not stepping in to prevent harm.
Sure.
Or to talk to their buddies about that.
Yep.
And so, yeah, I see that there's a real opportunity to leverage a lot more engagement from men to solve the problem.
I know that collectively, the two of you have not been there for decades, but I would be curious in your conversations with other staff members, have they shared with you at all, changes in the trends about who's receiving services from you all over time? I mean, are you seeing more men? Are you seeing more people that are experiencing challenges with identity or these other sort of bigger social issues that maybe, in the past, maybe you were just seeing women who are victims of, domestic violence and sexual violence, but maybe you're seeing something different now. Maybe it's more stalking, maybe it's more, I don't know, I'm curious.
Yeah, I mean, so yes, we're seeing a change. It's still, there's great stigma around a man coming and asking for help.
Sure.
A man admitting that, they've suffered harm either at the hands of a woman or another man. There's a lot of stereotype,
of course,
that pushes against that. So, but it's getting better.
Yeah.
And we do things like this to let folks know, to let everybody know that our agency is there and available with services for anybody and everybody, free of charge, 24/7. And we also know that marginalized communities are also at great risk, partially because they don't have a lot of support in the public sector.
Right.
And so that puts them, when folks are harmed, part of what keeps them in harm is not feeling like it's safe to ask for help. So that's always a problem, and that's why we're always going to be showing up and saying, we're here for you.
Yeah. No, that makes sense. So, we kind of talked a little bit about, specifically what it is that you do for the center, and then specifically what you do, but can one of you just broadly explain, like, what does the Center for Safer Communities offer for Sullivan County?
Sure. So, in summary, we offer kind of 2 branches of services. We have our crisis response services, so that's things like calling our crisis and support line, coming in and talking to a peer counselor, utilizing our 16-bed shelter, things like that. And then we also have our prevention education side, so that's what we've already talked about, going out into schools and educating the community about healthy relationships and body safety. And that's really our mission is to create safer and more inclusive communities. So our name really harkens back to that mission statement of wanting to create safer communities. Turning Points, that was a great name for a while, but it doesn't have that same ring to it. And so that was really our reason for the name change, and wanting to really highlight all of the work that we do, all of the support groups that we have, and all of the various roles that our staff have as well, from direct services all the way up to administrative roles.
So, one of the interesting things is just for those people who are watching that don't know, the Center for Safer Communities is not a government agency. You are a nonprofit.
That's right.
So how are you funded?
We are funded through some government grants. I would say
Yep.
about 40 to 50% of our funding comes from state and federal funding. There's a New Hampshire Coalition Against Domestic and Sexual Violence.
Right.
And we are one of 13 organizations that serve people in New Hampshire who are experiencing domestic and sexual violence. So, we apply for a lot of grants through that coalition, right? And then that money is kind of funded out. But also we rely heavily on donors. We rely heavily on family foundations that fund us.
Yep.
And then we have our major event that any person in Claremont knows about, the first weekend of May, is our Steppin' Up. Which this year is our 20th year, our 20th anniversary of Steppin' Up. And that brings in, unrestricted dollars that can really go directly towards people who are in crisis and people who need our prevention education.
Yeah, you guys definitely bring the energy. Too.
Yeah.
Yeah. And you usually go early May, so you usually have the benefit of good weather. So
hopefully, knock on wood, yeah.
So just briefly, how does the services that you offer at the Center for Safer Communities differ from other services that somebody may be able to get in the community, whether it be from mental health services or from the hospital or from law enforcement or the courts? Like, how does what the Center for Safer Communities, how do your services differ from those other professional services?
From the direct service aspect, so there's a statute that covers the work that we do as advocates, where it's considered confidential communication. So a person who comes in and talks with an advocate, it is privileged conversation, and it's protected by the statutes in New Hampshire. So we can talk with somebody and hear what their story is, hear what's going on for them. And then, so one is emotional support for that, being a witness to that, hearing them out, and then letting them know what opportunities are available. It may mean shelter. Oftentimes there are kids involved, and so it's figuring out, like, where is a safe space? And it might be shelter, it might not be. And then working with the legal system, the court system, and figuring out, like, is a protective order something that might serve them and help them out, and we can help them fill that out, guide them through the process. Again, that's peer support, so we're not legal advice, we're not legal agents, but we've walked through those forms a bunch of times, and we can sort of let them know what the statutes require, what the judges need to see and hear, and how what's going on with them, how that might, what they want to highlight, what they want to mention to a judge. And we can attend with them if it's appropriate for the hearing. If the order gets granted temporarily, we can go to the final hearing and be with them in that. Again, we're not an agent, so we can't speak in court, but we can be emotional support for them. And then a lot of it is just connecting them with other services and resources in the community that they may not be aware of. And it may not be something that we offer directly, but connecting them with resources.
Sure.
And we all know that there are lots of times when not knowing what resources are available is a lot of why people stay in bad situations.
I think, again, I mean, for those folks that have either been in a domestic violence situation, or have had a family or a loved one in a domestic violence situation, I think you can understand just how overwhelming that can be. And I think sometimes people that have not experienced that necessarily are just simply thinking about the physical abuse, right? But they're not necessarily thinking about, the financial abuse. They're not thinking about, like, okay, well, the abuser is the one that has full and unfettered access to the money and then controls the money. They're not thinking necessarily about transportation and how the abuser may have they may manipulate the transportation so that this person doesn't have ready access to go different places. And so when the person decides that, they're coming to the place where they think that they've had enough and they want to make the break, I can only imagine just how overwhelming that must feel. So how do you, in that situation as an advocate for them, try to help them? And I'm not trying to I'm not trying to be flippant here, but eat that elephant, right? How do you try to tell them, like, okay, one step at a time, right? We need to get you out, we need to get you into shelter, we need to get you financially secure, we need to get you transportation, we need, you know what I'm saying? Like, how do you communicate something so huge to somebody?
Well, I mean, the reality is they're aware of how daunting it is.
Yeah.
Right? I mean, that's what's kept them where they are. So when they're reaching out to us, something has usually happened that has shaken it up to the point where they feel that it could be lethal,
Sure.
or that it's really dangerous for their kiddos, or in some other way, law enforcement has gotten involved, or DCYF, that has sort of created a tipping point where now they have to make a decision. But yeah, they know that it's not simply one decision.
Sure.
It's going to be one, and then it's going to lead to the next and the next. We try to help them slow down, because you can't fix everything all at once, and rushing from one bad situation, often they find themselves in another bad situation. So we're trying to keep pace with how much things are changing pretty quickly, to keep them from, help them make best informed decisions. We also say to them all the time, like, whatever they're telling us, whatever they share with us, we know it's not the whole story. That there's always more to it. We're getting a snapshot, but we don't have the whole thing.
Sure.
And so, the reality is, folks come to us often, and it feels like they're at that tipping point. And then a few days later, they may decide not to do anything. They may decide to withdraw the request for protective order. They may, go back. And that can be, it's hard on us advocates, because
sure.
we care about these folks, and
Yeah.
we want good things for them. But it's also the reality that if they're not ready, they're not ready. Statistically, folks on average will try, it'll take 7 attempts to leave a bad situation.
That's interesting, because it's similar to recovery. Statistically, it takes 7 times for somebody to enter into recovery before long-term recovery sets in.
Right.
That's really interesting.
Right.
Those
Which,
numbers are the same.
for some folks, it's 1.
Yeah.
Right.
But
For some, it's 14.
folks, it's 14.
Right.
And one of our mantras is, we want to get you, if it's to the next try, or, we want to meet you where you're at and keep you going along that path. And hopefully, you do decide to make that clean break. And as I'm certain aware, that's also the most dangerous time.
It is. Yeah. I was actually going to get to that.
And
Yeah. Go ahead.
No, I was just going to say, so, we're very realistic and honest with folks about the challenges that they're going to be facing, and sometimes they want that they, if they leave this bad situation, things will get easier. But life is hard.
Yeah.
And there are lots of other pressures, and we can talk about ACEs and things like that,
Sure.
But there are lots of things that happen in people's lives that get them to where they're now in this bad relationship, this unhealthy relationship. And it's not like, oh, just leaving that all these other things get healed.
Right.
So it's going to be hard. And
Right.
and I don't want to give anyone any false hope. So, but we're also going to be there to help them manage the next situation, problem, challenge that
Sure.
comes up.
I think it's probably a really good time, if you don't mind, talk about what the empowerment model is and how that applies to what you folks do and how it applies to exactly what we're talking about here.
Yeah, sure. I mean, what we seek to do for people who are seeking our services is to empower them to make the choices that make sense for them. So if you come to us, we're not going to say, "Oh, okay, well, you've got to go to the shelter, right? Or you got to do this, right?" It's more about empowering that person through our support to then be able to make their decisions on their own, and even maybe beyond the time that they're working with us, right? To teach them those skills that's going to be able to kind of transfer and carry them through life, because some of these skills that we teach even in our prevention education, and then also when we're doing direct services, they're transferable, right? Learning
Sure.
how to set good boundaries,
Yeah.
that's going to serve you well no matter where you
Of
are,
course.
right?
Yeah.
Learning this is my bubble and I get to decide who enters my bubble.
Sure.
That is a really good lesson for people to know regardless of their age.
Absolutely.
And so I don't know if there's anything else to say about the empowerment model other than that.
Well, it's really interesting. One of the things, harking back to
Mhm.
talking about the education piece that I remember from back when I was in high school and talking about the empowerment model, and in how particularly folks who are exiting a domestic violence relationship, and they have been sort of subjected to this power and control dynamic.
Mhm.
It's one of the first times where somebody is saying, no, you're in control. You can make
Exactly.
this choice.
Exactly.
So absolutely, it's giving them the agency to establish boundaries, and which has a larger reach than just in that one particular situation, but it's also letting them know that somebody's doesn't always have to make your decisions for you.
Right.
You're a human being with agency, and you can make decisions. And so the empowerment model is one of the first steps in allowing that to happen. I think sometimes there's a misconception about the empowerment model. And I think it can even extend sometimes into law enforcement, because the empowerment model doesn't necessarily mean that we can't point somebody in your direction,
Right.
or make an introduction, or connect a survivor with an advocate. It just means that at that point you can explain who you are, you can explain what is it you can do, you can sort of loosely offer those services to them, and then they can decide, right?
Right.
The empowerment model doesn't just mean, oh yeah, our office is on Broad Street,
No.
and so find your way there. That's not what the empowerment model means, and I think that sometimes can be a little bit of a misconception, right?
Right.
Yeah. There's still very much like wraparound support. There's still very much like but it's your journey. It's your choices, right?
What is wraparound support?
So-
I know, and of course, Ray, but for other people, what does wraparound support mean?
Wraparound support means that you're not just getting support from one sector, that we as an agency are working very close with law enforcement, maybe with DCYF, maybe with some other organizations, and that we are really working to support and if you think of like a blanket, like wrap
Right.
that blanket, wrap those
Sure.
warm arms of compassion around that family.
Sure.
Because, when someone is experiencing domestic or sexual violence, that has a ripple effect, right?
Yeah.
Within their lives. And so we have to make sure that, we aren't just addressing the survivor, but also if there's any, ripple effect within their family unit, or friends or any of that, like that, we are also there for them. And so really just
Sure.
like wrapping our arms around the entire situation and all of the people that are involved. And knowing that also when you give someone agency, right, that you also have to take a step back and allow them to make a choice, right?
Right.
That you can want it. And I know
Yeah.
this, you know, I used to be a high school English teacher, and so I know this from teaching my students, is like, you can want that student to study and write that paper and get that A, but it's until they want to do it, right?
course.
And so it's this very, very similar thing. It's like,
Yeah.
you know, you can give them all of the supports, but as Ray said, sometimes they may go back and they may do that 7 times, like the average says, until they decide, okay, now I'm ready to take those steps, right?
So we talked a little bit before we started the interview, and about some of the things that we may talk about, and I'm just sort of curious. But somebody that is coming out of a domestic violence relationship or a really bad situation, you know, I assume that in terms of emotionally that they're just they can sometimes be a mess, right?
Mhm.
And everything is like the wiring doesn't feel right to them, right? Obviously everything can be righted, but you know, in the moment things are all out of whack.
Mm-hmm.
I'm curious. Do you ever suspect that if somebody comes to you, they almost they don't want to let you down? So if you're telling them like, oh, well, we can help you with court process, or we can help you into shelter, or we can do this, we can do that, and that there's a sense maybe from them that like I don't want to let Ray down because they're helping me, and I've let everybody else down in my life, and they, you know what I'm saying, that almost like, talk about a blanket, but they almost feel like just
Well, even I think
despair.
almost more than like, oh, they're worried about letting me down as their advocate. I think there can be that erosion of self-trust
Sure.
that's gone on.
Yeah.
You know, oftentimes because they were consistently and constantly told that they were wrong, that things were their fault. And, you know, it may seem overused, but I hear it all the time. You know, folks will come in and one of the things they'll say is, I have to walk around on eggshells all the time. And I think most of us think like, oh, I know what that means, but I don't think we really do.
Sure.
Unless we were in that kind of a situation where someone is so volatile and you feel so unsafe in your life. So when you go from that to, you know, hopefully a process through the courts and through law enforcement where that's been taken away, I think some folks have been so used to that wall being there and then it's removed that they feel like they're in free fall.
Yeah.
And it feels really scary.
Yeah.
And they don't trust themselves. So while we talk about empowerment, sometimes folks feel very much like, no, just tell me what the right thing to do is.
Yeah. Right.
And we, you know, so we, as I said before, we try to slow down to help them really explore, like, what is it that they need? What is it that they want
Sure.
right now? And it doesn't have to be a big decision, but it might be, you know, what are they going to eat today? Or, you know, where do they want to try to find a place to live? Or what might they explore as far as, you know, work? You know, small steps like that.
Yeah. It's interesting too, because I think when you talk about what preconceived notions are, again, I think sometimes there may be this preconceived notion that anybody who goes to the center is only going there because it's the worst of the worst. It's right before, you know, a fatal encounter or something like that. But the reality is, domestic violence, I don't want to say never, but I would put paychecks, several of them, on almost never does it ever start there, right? It always starts with small things, right?
Mm-hmm.
And those small things become bigger and bigger. And I'm now talking the abuser. They don't start at the worst.
Right.
They start with subtle manipulations. They start with they test you a little bit here and there, and then it's small things, and those small things get bigger. And what's really insidious about it, from my understanding, is that it starts to normalize too for the survivor. Like, this is okay. Like, they may start to feel like this doesn't feel okay, but it almost becomes like the pattern becomes what feels like normal, but it gets worse and worse and worse. And somewhere along the path, they may say to themselves, well, I need to get out of this. I need some help. But boy, he's not throwing me down the stairs. He's not hitting me with a hammer. He's
Right.
You know what I mean? He hasn't pulled a gun on me. But as we know from the lethality assessment protocol, left unchecked,
Right.
it often will go to
Right.
a very, very, very extreme, very dangerous situation. So how, from an education standpoint, how do you communicate to people that you shouldn't wait till it gets to that point? You should identify, troubling, problematic behavior early and get help.
But we talk about the cycle of abuse, and I think of it, and just to explain to folks, so typically there's a honeymoon period. Things are good, both people are excited. The relationship, both people are on their best behavior, showing their best,
Yeah.
sides of themselves, and then slowly, the nitpicking, the like, oh, I don't like this part or that part, and just getting more judgmental about things. And I mean, we all do that, right? So it feels kind of normal, but if it becomes a pattern and it's harmful and it's it erodes, as I said before, someone's self-confidence, that's a sign of a problem. And oftentimes in the cycle of abuse with an abuser, that grows until there's a volcanic event, some volatility, there's an explosion of, I'm so upset because you did X, Y, or Z.
That in between, if I recall correctly, is the honeymoon phase. Is that, or tension? It's the honeymoon, the tension building, and then the
Right.
explosion phase, right?
Yep.
And they don't all. It's not linear, right? So it's not like, oh, you're in the honeymoon phase for a month, and then you're in the
Right.
tension building phase for
Right.
a month, and then you're in the explosion for a month.
Right.
Um,
Right. It happens as it will. It's organic about it, but yeah, that tension builds as the honeymoon phase sort of diminishes. The tension builds. There's the explosion, and then there's often the, I'm sorry. I apologize. I didn't mean it. It won't happen again.
Yeah.
It was
the love bombing,
right.
yeah.
Flowers.
Flowers,
Exactly,
date
like
nights,
making up for it.
Sure, yeah.
Forgive me. But also the lack of accountability of
course.
stress at my job, or I was drunk, or I haven't been sleeping well, or
I'm just passionate.
yeah,
I'm not violent.
I
I'm
get
just
excited
passionate.
about things and
Yeah,
I'm sorry.
Yeah,
But then there's the apology, which then leads into the love bombing and another honeymoon phase.
sure.
But what we see and what's known is that those phases tend to speed up.
Yeah.
But they also, I don't think of them just as a circle, but a spiral, because also the harm and the volatility, the anger, all ramp up. And so when it starts out with perhaps just harsh words and criticisms, soon enough it's, well, glass is being thrown or walls are being punched. And then, we can get to, now weapons are involved,
Sure.
or physical harm, or hands around necks.
Yeah.
And yeah, often it rarely stays the same or gets better.
Do you find that it's challenging to confront these types of issues when it's generational? So when somebody has grown up either I'm just going to use sort of the man as the abuser here, but when a man has grown up in a domestic violence home and has watched his abusive father abuse women, or vice versa, when a young lady grows up in a home where she's witnessed domestic violence against her mother, and this is all they've seen, so generationally they know victimhood and they know anger and aggression and violence to control people and to manipulate people. How do you confront that from your standpoint, from what you guys do? In an instant, somebody comes in and they've had decades worth of this patterning, to confront that and to try to recognize this is not okay. This is not normal. What you've seen your entire life is not okay. And how do you?
I think for me, and I don't know if this answers your question, but as I have gone through a lot of training, being a new staff member around domestic and sexual violence, is really developing compassion not only for the survivor, but also for the perpetrator. Because we know through statistics that, for example, people who perpetrate sexual violence often have experienced sexual violence themselves.
Sure. Mm-hmm.
Right? And so that cycle of abuse, right? It can be intergenerational, and so while I still want to hold perpetrators accountable, right, and there are certainly societal expectations for how you should behave and treat people, at the same time, when people are hurting, it's that phrase of hurt people, right?
Yeah.
And it's like when people are hurting, sometimes they take that out on other people, and so we really, I think, as an organization and kind of our mentality around the prevention education is, well, hopefully if we can stop some of this before it starts, if we can teach kids about, hey, this is how you respond when someone says, no, I don't want to play with you.
Yeah.
Right? This is how you can respond to that without beating them up.
Yeah.
Right? Or without behaving like a victim yourself and, going and crying and telling the teacher that you can be empowered in your response to that. Right? And so, I don't know if that answers your question.
No, it does. I think it's just such a huge hill to climb. I think when you're trying to overcome, generations of abuse, victimhood, to try to make that known. And to your point, when you folks are in the school early, and I saw something somewhere along the way talking about how, realistically to make communities safer and better, and to pull people out of poverty and to pull people out of domestic violence situations, the best place to focus is young mothers, right? And communicating to young mothers on how to, that period of a person's life from 0 to 3 is probably the most foundational period of their life. And so if you can get to young mothers in that period of time and communicate to them, this is how you should model, and raise your children. And it's just interesting how some of those things, they stick for so long. And I mean, we see it here. I grew up here. I've worked here now for over 2 decades, and I'm dealing now with children and grandchildren of people who I dealt with long ago. So it's interesting just how I think sometimes when I think about your mission and what you do and where you're doing it, I have all the respect in the world for you, because I think a lot of what we see in Claremont is generational poverty, generational behaviors and attitudes and stuff like that, and overcoming that, I think, could be.
And I think it's really important to know that it really takes all of us. I think sometimes with issues like this, it can be easy for people who maybe don't have an immediate proximity to domestic or sexual violence to be like, it's not my issue, right?
Yeah, sure.
I don't have to deal with that in my household, right? But really what we know, and again, just using this as an example, but one of the many safety factors for kids is having a trusted adult that is not one of their parents, right?
Sure.
And so if you can just be a healthy adult in this world, right? If you can just show up and be a healthy adult, and maybe be a healthy adult for a kid that needs to come to you one day and tell you something about, hey, something's going on at home that feels kind of weird and messed up and I don't feel good about it, that is helping solve domestic and sexual violence, right? And so I think people sometimes, they count themselves out of being able to support, or, I don't have any money to give, so I can't support their mission. And that really, there's so much more that you can do beyond that. And one of the things is educating yourself and then passing that education on to your kids or your grandkids or kids in the community or whatever.
Is it 1 in 4 women is a victim of sexual violence, or a survivor of sexual violence, I should say. So thinking about that, I mean, mom, sister, cousin, friend, mom, sister, cousin, friend, there's 4, right? So statistically, one of those people is going to be a survivor of sexual violence.
Right.
So while somebody may say, well, this doesn't have any impact on me. If it doesn't now, it's going to.
Right,
And
exactly.
we're not wishing that upon you, but
No.
the law of averages says that
Yeah. Everyone knows someone.
everybody knows
Right.
somebody.
Somebody
Yeah.
you care about.
Yeah.
Right.
Yeah, has suffered
Exactly.
this.
Yeah.
What are you seeing sort of in the city or in the county as a whole in terms of trends right now that if you're willing to share?
I think the intersectionality of a lot of the pressures that people have. So, struggling with housing, homelessness, which puts pressure on folks. Food instability. Jobs.
Substance
Use and misuse.
So it's interesting you say that, and I don't mean to interrupt, but I just, when you talk about the pressure, that obviously can influence somebody's decision about whether to leave a situation, but somebody that may not have the coping skills to handle pressure as an effective adult, right, may outlet that onto other people in unhealthy ways, right? So now you're facing like the landlord's breathing down your neck for the rent payment, and you don't realize that, like, okay, the most effective thing for me to do is maybe get a second job, or find a job that pays me more money, or cut out some of my vices so that I have less expenses and more revenue, right? So instead of finding productive ways to solve that problem, they may take to whether that's substance use or violence, because that's something that, again, less emotionally intelligent people think, well, I can control that, right?
Right.
That,
or they haven't seen anything better modeled.
Sure.
So again, we're talking about this intergenerational
Sure.
issue. We've talked about ACEs, so adverse childhood experiences.
yeah,
Why we go into classrooms is because, again, there's an assumption or presumption that most of the kids are getting these same messages at home, on their teams, in the classrooms, about respecting one another, taking no for an answer, asking for permission, things like that. But also the reality is there are homes where that's not happening. There are homes where there is abuse going on. There are homes where not only that, but there is substance misuse, or there is the threat of homelessness,
sure,
or there is food scarcity.
yeah,
And so, they're seeing parents and caregivers trying to figure things out, but struggling, and not being emotionally intelligent, stable, mental health crisis that we're in as a nation.
right.
So all of these pressures, these kids don't feel safe in their lives, in their own homes.
Interesting point to that is that is an ACE.
Right.
So as a child living with somebody that has a diagnosable mental health disorder is an ACE. And we know that ACEs aren't all the same. And we've talked before. We've had Stephanie on before, and we've talked about the fact that the police department has an adverse childhood experience response team coordinator, and we were grateful for back then. Turning Points was a huge part of helping us get the grant for that program. And we know that ACEs aren't all the same, right? So we know that somebody that experiences sexual abuse as a child, that's different than somebody who, it's a more impactful ACE than somebody that is experiencing homelessness for a short period of time. Now, please do not misconstrue what I'm saying to say that homelessness for a short period of time is okay or it's not harmful. But we know that ACEs, again, they're not linear. They come in all different shapes and sizes. But I think what's interesting about ACEs and the literature on ACEs is how destabilizing ACEs are for children, and how, like you said, they have parents who are suffering from mental illness, parents who are addicted to substances of one variety or another, parents who are incarcerated, parents who die.
Right.
I mean, these are ACEs, and then there's obviously the physical abuse, emotional abuse, sexual abuse, ACEs. And so, why do we, as a police department, as a community, as a collective, why do we try to improve ACE conditions and prevent them? It's because we recognize the literature says that we can improve outcomes in adulthood, which ultimately is short-term death.
Right.
I mean, think about that, right? Like,
Right. There are, right, exactly.
Kids that experience
mental
these
health,
things.
Right. But even just physical health,
Yeah.
they show, statistically is affected. Life duration is dramatically affected by folks who have had 4 or more ACEs.
Yeah, we're not talking about they're gonna be the victim of homicide. We're talking about just their overall lifespan is going to be
Right.
reduced.
Yes.
Right.
That is alarming. When I
Right.
first started looking at the literature on ACEs and ACE certs and how we can all work together to do this, that like a light bulb went off. Like,
Because it feels really abstract. Like,
It does.
that would make sense. Like, oh, well, yeah, you get involved in drugs and then you die
Overdose.
in a drug-related,
Yeah.
but it's not, it's more abstract. It's like,
Yeah.
oh, you have high blood pressure or you have
Yeah.
heart disease
Cancer.
or
Yeah.
cancer.
Yeah. Yep.
But statistically, it can be related and
Yes.
Yeah.
connected to ACEs. But we also know that there are protective childhood experiences.
Of course. Yeah.
Things like having a trusted adult outside your home, one or more people who you can go to where you feel seen, heard, and respected can make a difference. So, when I talk with folks, it's informing them about ACEs, but letting them know, ACEs isn't a death sentence.
Right.
It's information, but there are strategies for it. And, I always think, so we're talking about in that home where, child is experiencing, adverse conditions. A lot of times those parents were those kids a generation ago. And that's where we start looking at how do we break the cycle of ACEs.
Yeah. I think it's, I was hearing recently, and I'm not sure if the two of you are aware, but the story of Oprah Winfrey actually as a child and what she went through was absolutely unremarkable. Like
Yeah.
no human being should ever have to go through what she went through.
Mm-hmm.
And then to achieve all that she has achieved in her own life and to become the person that she has become is unbelievable. And I do think sometimes it's a little unfair. I think society has these unfair, like, pull yourself up from your bootstraps expectations of people, because you look at somebody like Oprah Winfrey and you're like, well, she grew up without a father, she was sexually abused, she was bounced all around and put up for adoption, this, that, and the other thing, and look at her, she sells books, she's a gazillionaire, like, yeah. But that's like the Michael Jordan of pull yourself up from the bootstraps, right? Like, that's not the normal experience of people. But I do think that, unfortunately, that is, I think, the message that we in society send to people that are in tough situations, that like, you just need to
Just try harder.
be gritty, try
Right.
harder.
And if you don't, shame on you.
Correct, it's your fault. You're old enough now that you should be able to make these decisions.
Right.
You're
And none of us get anywhere alone.
Right.
Yeah. That's the thing is, like, I don't know much about Oprah's story, but I know she was during her early years as a news anchor before she was famous.
Yeah.
She had a lot of people in her corner that maybe weren't her family, but
Yeah.
she maybe had some trusted adults, right? She maybe had some people, and sometimes that's all it takes, right? Sometimes that's all it takes is just to even despite all of this other adversity that she had been through. And so, I think that's one of the things that I keep coming back to is, like, we can all make a difference.
Yeah.
Even, like, I don't have kids myself, but that doesn't mean that I can't impact the kids in Claremont, right?
Sure.
That doesn't mean that I can't have some sort of influence on my community. Even though I'm not going home to my own kids myself, teaching them at night, right? About healthy bodies and
Sure.
safety and stuff like that.
I think one of the takeaways I always have when I speak with folks that do the work that you guys do is you just never know what somebody's dealing with. You never ever know, right? And we can say sort of flippantly sometimes, you already have skeletons and all this other stuff, but, like, not only do people have skeletons, but people also have a lot going on behind the curtain that they're not going to talk to you about. And if you can pierce behind the curtain, a lot of times you can, as just being a good human being, you can make a difference. Right. And it's not necessarily making a difference like Oprah Winfrey makes a difference.
Right.
You could make a difference, as you were talking about, like, if it's one person outside of the home other than a parent can make a huge impact on a kid's life. Just being a positive role model who's not there to exploit somebody or to take advantage or something like that. I mean, what a huge lesson to all of us on just being a good neighbor.
Right. Yeah, being a good neighbor.
So for anybody that's listening to us now, like, and they're aware of somebody who's in a tight spot or they're in a tight spot in a dangerous situation, what advice, suggestions, what could you say?
I'll start, and then
Yeah,
you can
yeah.
cover anything that I missed. But I would say first, we have a 24-hour a day, 7-day a week, 365-day a year crisis and support line. You do not need to fully be in crisis in order to call the support line. You can just have a question. You can just have a concern. You can just be afraid and need some advice. Or it can also be a full-on domestic or sexual violence crisis. And so I would say that's the first place to start, especially if you're feeling like you need services. We also have a chat feature on our website that's available Monday through Friday, 9 to 4. So it will be available right now if you're watching this live.
Yeah, well, we're going to put up at the end,
Okay.
at the end of the video, we're going to put up information about how to contact the
Yeah.
Center for Safer Communities. So
Yeah,
have your
and-
phone numbers and your website.
Yeah.
And
You can also text with an advocate, I think. So it's chat, text, or phone, whatever is easier for you.
sure.
And you can do that anonymously. So
Yes.
when you call in, you don't have to identify yourself. We will ask, but you don't have to. And you can just ask questions about yourself. If it's a loved one that you're calling about and you have concerns for them, again, we're there to answer your questions, to maybe connect you with resources. Ideally, we would want the person in crisis to come in, or talk with us directly.
Yeah.
So that we can see where they're at because, again, empowerment, we want them to make the decisions for themselves.
Yeah.
Sure. So it's October, and we kind of opened by saying it's Domestic Violence Awareness Month.
Mm-hmm.
So does the Center for Safer Communities have anything going on that would be?
We do. We have a few things we've been doing this month. One thing is you might have noticed at some of the coffee shops around town, there's coffee sleeves that have our number on it, and I think say like end violence or something like that. Definitely keep your eye out for those throughout this week. And then we are also going to be at Hallowista
There you go.
on Friday.
I have a wicked sweet tooth, so I'll probably see you.
Handing out candy and also handing out cards that have our new name and logo on them so that people know who we are, that Turning Points Network is the same as Center for Safer Communities.
Sure.
We're the same people doing the same work, just a new name and new logo. So
I think it would be remiss of me not to talk about this because you two are talking to the police chief. So, and we haven't spent a whole heck of a lot of time talking about how our two roles in the community sort of interact at times. So, I'll just throw out a couple different things, and if you can expand on things, or if I forget something, please do. I think one of the things, first and foremost, and something that came up very recently with that tragedy that happened in the city of Berlin, discusses the lethality assessment protocol, or the LAP screening that we do. And this was, again, born out of research. So it's not just something that the Center for Safer Communities and the Claremont Police Department just ad hoc decided to do. This is something that is backed by empirical data.
Mm-hmm.
But ultimately, when we respond to a domestic violence situation, we go through this protocol, and if the survivor screens in, we make a phone call to the Center for Safer Communities, and we afford the survivor the opportunity to talk to an advocate. And if they choose to take that, then good. And the point behind doing that is that we recognize, as you said earlier in the interview, that we recognize that is sometimes the most dangerous moment. And if we can intervene and at least point them in the right direction. Again, this is not a violation of the empowerment model. It's just helping to illuminate what is out there for services for them, that it can reduce the number of fatal domestic violence encounters. That's the idea behind LAP. Did I miss something, or?
No, I mean, so those questions are tailored and specific based on data, like you said. And when somebody screens in, that means that they've answered yes to certain criteria, and so that's the protocol, and we appreciate getting those calls. And when we get to talk with that survivor, it's our duty. We're trained to. It's one of the only times that we are as specific as that to say, based on what has occurred, people have been killed.
Yeah.
In
Right.
your situation. So we strongly recommend that you and we work on making a safety plan with them.
Sure.
So yeah, it's 100%. We're so grateful to be part of that process.
Yeah. Um, Other areas that we interact with your staff, and again, recognizing, as you mentioned before, statutorily, there is a protection, privileged communication, like husband and wife, like a pastor and
Congregant.
a congregant,
Yep.
or a doctor and a patient, right? There's a very clearly defined statutory expectation of privacy to that communication.
Mm-hmm.
But so we don't call you, and sometimes I will freely admit, particularly as a younger police officer, if I'm like, Ray, I just need to know, is so and so, are you working with so and so? I've got paperwork for them. I can't tell you. It's like,
Right.
oh, come on, but you don't.
Right.
And you hold that information sacrosanct, but we communicate with you and put people in touch with you when it comes to domestic violence, restraining orders, stalking orders. If we have a survivor come into the police station to report abuse, whether it be sexual abuse or domestic violence, we will connect with you. We give them your communication. Certainly, if it's a situation where we're going to be bringing somebody to the hospital for some sort of an exam, we have you folks there with us. So there's an educational component to how we interact together. And Amanda and I recently have been talking about getting your staff with county law enforcement together for training on the services that you offer, specifically on lap screenings, and making sure that we are working together as best as we can.
Sure.
To support the community as best as we possibly can. So, did I miss anything?
No,
I think so.
Yeah, I know. I mean, even the resource officers in schools, so we're connected with them and, try to work with them in supporting kids in schools with things that come up. So there are just lots of different ways, and we're so grateful because, I think our goal is the same.
Yeah.
That we want people to be safe
Right.
and protected. And so it can be frustrating when you have a question or you need some information and I can't just easily convey that to you. But, we will listen and we can pass information on if it's important. But yeah, we're always going to respect that boundary as well. So,
Sure,
but we
sure.
appreciate working together.
Yeah, so do we. So we'll go around the table real quick. What message, if you could get out to the community, to any people, what do you think would be the most important message that you could send?
I think it's just really important to realize that even if you don't think you know somebody who's affected by domestic violence, you likely do. And if you're a man, if you don't know, it may be because they don't feel safe telling you.
Sure.
Yeah. And I would say, going back to that, it takes all of us. It takes all of us to keep our community safe. And, all of us likely do know someone. And like you said, if you don't, you should probably reevaluate a little bit. But it really takes all of us to end violence in our communities, to make our communities feel safer, and to make our communities, a place where we want to live, where we want to raise our kids, where we want to see our grandchildren thrive.
Yeah. I think from what my takeaway from speaking with the two of you today, I think, and I'm, maybe because I'm the chief and it's my podcast, I get to say two. But one is, I think that just the message that, just simply being a good person and being a good neighbor has a bigger impact than sometimes people can realize.
Mm-hmm.
And I think that the other thing that both of you have talked about significantly today is how, there's this perception about what domestic and sexual violence is, but it's so much bigger than that. right? It's so much, it's so insidious, it's so large, and like you said, you know, while you may say that you don't know anybody experienced it, you probably do. And it's not just, you know, those fatal encounters, because they start, you know, way down at the gaslighting, and they go all the way up to the worst of the worst. And you know, there's help out there, and there's a lot of people, and I can tell you from working with Women's Supportive Services and Turning Points and now the Center for Safer Communities for more than 2 decades, there's no people in our community who care more about vulnerable populations and helping people in these tight spots than you all do. So I'm grateful. Thank you so much.
Thank you.
Thank you for coming in and talking. This is the first time we've talked here in this particular office, and I'm glad that you guys were the first guests. So
Yeah.
thank you so much.
Thank you.